medical interventions during childbirth. I'm going to start by saying that we're incredibly lucky that we have access to those interventions if we actually need them, because they could potentially, save the life of a mother or baby. So yay, we're grateful for interventions when they're needed. Key phrase being when they're needed. There are plenty of times when interventions are used when they're not needed and when mom doesn't want those interventions. And so if you're wanting, a vaginal birth, especially an unmedicated vaginal birth, you're going to want strategies to, avoid as much as you can those interventions. So first off, there's things that you can do while you're pregnant to help to prevent the likelihood of needing an intervention during childbirth. So one is practicing relaxation techniques every day. So stress is a big factor in many of the special circumstances that could come up that could require intervention. So doing, about 30 minutes of relaxation techniques every morning, every evening, like breathing, listening to a guided meditation, can be incredibly beneficial. And then of course, utilizing those same relaxation techniques during childbirth will help to keep you calm and healthy during the birthing experience. Right. Doing perineal tissue massage every night for the 4 to 6 weeks leading up to your due date. I have a video on here about how to do that perineal tissue massage. It's so incredible as it helps your perineum, which is the muscles and the tissue like between your vagina and your rectum. It's the area that creates kind of that like ring of fire that we've all heard so much about. And so doing this perineal tissue massage helps that area become more elastic, which is nice, helps it bounce back better after baby comes out. It also helps it unfold and expand, making the pushing phase of labor easier and hopefully faster. So I'll do a quick tutorial on the perineal tissue massage. Again, I have a longer one in the video somewhere below. So you get an oil with only one ingredient: jojoba oil, almond oil, olive oil. You coat these two fingers or your thumb in the oil. You sit on the toilet, obviously with your pants off, stick your feet up on a chair. You insert the fingers or the thumb about 2 inches into the vagina, and then you follow this horseshoe shaped pattern, really focusing on the bottom. That's the tightest part, and really stretching it out. I recommend pushing it to the point of discomfort so you can actually practice, your breathing techniques, your other relaxation techniques, and see that they actually work, and see that that perineum can be stretched without your body exploding, which does not happen. Oh, another great thing about this perineal tissue massage is it helps to minimize your chances of tearing, which is huge. So practice that perineal tissue massage 10 to 15 minutes every night or every morning, whenever you want to do it, for the 4 to 6 weeks leading up to your due date. And if you want some sexy bonding time, have your partner do it. Okay, unless your care provider says otherwise, engage in some light exercise and stretching every day. So doing something like swimming. Swimming is so great because it works almost every muscle in your body, and it's really light on the joints. It's like pretty much wonderful in every way when you're pregnant. Walking is also great, but you really want to strengthen your muscles so they can support you during birth. You might think that only your abdominal muscles and your uterus are what's needed to have a healthy birth experience, but a lot of times, like a day or two after you have birth, you feel like you ran a marathon. Like every muscle in your body is sore, showing that in a lot of ways our entire body is participating in birth. So we want to keep our entire body strong and healthy. We want to have good cardiovascular health, and we want to be flexible too. So do some light stretching. Getting into a prenatal yoga class is awesome. They can show you safe ways to stretch it out. Sleep as much as possible in the days leading up to birth, as fatigue is one of the main reasons, at least in my experience, that women have needed interventions. I've seen moms that were so incredibly exhausted that they had to get the epidural because they had to sleep before they were going to be able to push their baby out. So the days leading up to birth, to your due date, whenever you're tired, sleep, rest. When you go into labor, when you're in early labor, even though you're excited, even if you can't fall asleep, just close your eyes, lay down, try to get as much rest as possible. Trust me, rest is going to serve you more than hardcore nesting in those last few days, as much as I love nesting. Okay, nurture yourself with healthy food and water. Of course, we know we want to stay hydrated. We want to have protein-rich foods. Continue this through your entire pregnancy, and you should be pretty good to go during childbirth. And when you go into early labor, make sure you drink lots of water and have a nutrient-rich meal to set you up for success during birth. Okay, if possible, hold off on inducing. Unless there is a very real medical reason why you need to induce, hold off. Hold off on Pitocin, Cervidil. With natural induction, I'm of two minds, but I think there's no need to rush it unless, again, there's a medical reason why you need to get things going. So the thing with Pitocin is that it can lead into something that's called the cascade of intervention, where you get one intervention that leads to another and another and another. Pitocin is artificial oxytocin, and sometimes it can be great and it can stimulate labor, get things started, then they pull you off of the Pitocin and you keep going on your own. But sometimes you become totally reliant on the Pitocin, you can't have surges without it, and sometimes it creates abnormally strong surges, contractions, so much so that you need that epidural. So if possible, don't induce. Okay, so let's say you're at the hospital, you're birthing, and the doctor comes in and is like, you know what, I really think we should do this intervention. So before you say yes, number one, it's really important to ask, is this an emergency situation? If they say yes, ask them to quickly tell you why, so you really know if it's actually an emergency. And then if it's not an emergency situation, ask for some time to decide. Ask for some time to think, to talk to your partner, your midwife, your doula, your people. Ask for time to decide. It's also important to ask, again, if it's not an emergency, what the medical reasoning is behind them recommending that intervention. Ask them about the risks. A lot of times care providers tell you about the risks if you don't do the intervention, but they don't talk about the risks of the intervention. So ask about those risks. And this is kind of cheeky, but I kind of like asking the nurse. When the doctor is out of the room, ask the nurse what her opinion is. Most of the time, they're just going to agree with the doctor. They don't want to rock the boat, but sometimes you can get something out of the nurse, and sometimes they don't agree. So not that you have to do exactly what the nurse says, but it's just another helpful opinion. All right, and before you make your final decision, take some soothing breaths, get yourself out of a state of anxiety by, again, breathing, having somebody give you a massage so you can make the choice from, again, a calm, centered place. Okay, and finally, it's really important to remember that if you do choose to accept an intervention that you hadn't originally planned on, you are in no way a failure. Nobody knows exactly how their birth is going to unfold, and it's totally normal and natural if throughout birth you decide, hey, you know what, this intervention actually sounds like a good idea for me, and I'm going to make the informed, empowered choice to say yes.